Kelly Clark is the Marketing and Communication Specialist with Titusville Area Hospital, and she joins us here this morning, and she brought in a special guest as well. Good morning to everyone. How's everybody doing? Good morning.
Hi,
good morning.
Luke.
How's
How
it
are
going?
you?
Good. How are you?
Good. So I brought with me Devon Zurovchak. She is our new audiologist at Titusville Area Hospital. It's a new service that we are in the process of adding. So I brought her along today to introduce her and talk about some of the services.
Devon, thanks for being with us.
Yes, thank you for having me. I'm excited.
Tell us a little bit about yourself.
My name is Devon Zurovchak. I am originally from Columbus, Ohio. I grew up there, but my family is from here, so I kind of know the area. We're here every holiday, so I'm really excited to I wouldn't say be back, but be here, and I'm excited to get started. So
That's excellent.
Yeah.
So how did you get here? Talk about that path. When did you know that this was the field you wanted to get into?
Yeah, so I guess there's two pieces that kind of went hand in hand. My mother is an occupational therapist, so growing up I kind of knew I wanted to do something like therapy related. Originally I was looking into physical therapy actually, but during the summer in high school I was a lifeguard. I lived kind of close to the Ohio School for the Deaf, and so they would come and do like excursions at the pool, and I got really interested in sign language actually.
Oh, wow.
And kind of looked into jobs that worked with sign language. I didn't necessarily want to do interpreting, but found that audiology was something that worked with, hearing devices, hearing aids, and the hearing impaired. It also worked with populations that use sign language, and so I got really interested in kind of delving into more about the occupation. And then I had family members that were in hearing aids as well, so I just was kind of interested in how those worked and how they benefited them and those kinds of things, and so I kind of just fell into it that way.
Listen, probably a shock to know that swimming and Zurovchaks go hand in hand. There's such a rich history there.
Yes.
So it's not
I
a shock.
also was a swimmer in high school
Yeah,
too, so
right. Not
swimming
a
and water
shock.
polo.
Yeah, all right. Well, so did you find that the more you got into this, or when you said, okay, I'm going to start studying this,
Yeah.
more excitement you had to continue with it?
Oh, yeah.
Okay.
So originally, in undergrad, speech and hearing go together. So a lot of the courses, a lot more people go into speech pathology. So a lot of the courses were geared towards them. There were only a few that were kind of audiology, and they're later in your coursework. So I was just waiting, and then we got to them, and I was like, yeah, these are for me for sure. I love my professors that taught them, and then got into grad school and immediately was taken with everything. And it was just really fun to be with kind of my cohort was a group of eight women, and it was really, really a great time. And I kind of loved learning everything to do with all of your hearing system and your balance systems also in your ears and kind of all that information. It was really, really great.
That's awesome. Kelly, obviously a need for that in this area, right? Because talk about how this came about.
Yes, definitely a need. So as you know, we have a new ENT specialist. I've had her on the show, Dr. Panero. She brought some new things with her. We started doing allergy testing. She became full-time almost immediately after taking that position, and we are so busy that we're adding another ENT provider.
Oh, wow.
And realized that we are also in need of audiology. So it was kind of a step-by-step process of seeing that need firsthand. So it was great that we could add this and I will be bringing her on as well, Dr. Policina. She'll be the new ENT provider that will work with these gals as well.
Wow. So Devon, just kind of give us a snapshot of maybe the patients you're seeing, from what age to what age, and then, what are some of those things that people should know or understand if they're struggling with hearing or whatever? Just kind of give us a snapshot of everything.
Yeah. So I can currently see ages anywhere from kindergarten to adult populations. Usually, if it's going to be kind of a younger kid, sometimes they fail a school screen or something like that and need to come in for further testing. Usually that's pretty quick. but anywhere in the adult to geriatric population, it could be anything. Like if you're having an ear infection and they need to, the ear, nose, and throat specialist needs to work with you for that to place tubes in your ears or do drainage, or you're on antibiotics. We do pre and post testing for those kinds of things. Or if you're having any difficulty kind of with your hearing, usually we would do testing and see if you're a candidate for hearing aids and kind of go forward in those spaces as well. That's generally the most that I'd be doing, is kind of just the diagnostic kind of side of, for children, are you hearing the way that you should be, or just anyone in general, making sure that we're kind of going over, if there's a hearing loss, what that means for you and what next steps are.
How often should you be checked for your hearing?
It depends. Typically, like with younger children, usually they do a school screening. Typically, I would say every year. Sometimes it doesn't happen that often. And then with adults, if we're testing and you're within normal limits, usually if you're starting to feel like, ooh, like I'm hearing, like saying what more, or asking for repetition more, then you can come in and be tested. If you have a known hearing loss, usually we say every year, just to make sure that nothing's changing.
And there's some normalcy there, right? Like if your spouse is talking to you and you choose to ignore them.
Yes.
That's okay.
Definitely.
Okay.
A lot of selective hearing kind of going
Gotcha.
on there. We do get people coming in and saying, oh, I can't hear my wife from 2 rooms away. I'm like, well, yes, that's completely normal.
Okay.
But
Or if
you
you're in the
guys are
shower and
next to each
somebody
other,
chooses
right?
then to talk to you and you're washing your hair and it's like, can you
Can't hear
just wait till
anything.
I get out?
Exactly.
Okay.
That's completely normal.
All
But if you were like sitting kind of next to someone and you were like, oh gosh, I'm not picking up on what's being said, that would be a time to kind of come in and check that everything's going okay.
Normal to, as you get older, to start hearing less and less?
Typically with age, you do kind of start to see some loss, usually starting off in the higher frequencies. And that is what provides clarity of speech. So people saying, oh, I can hear that you're saying something, but I can't quite make out what it is. That's generally a sign that we're starting to show some age-related hearing loss.
I see stuff pop up all the time with, what technology is doing. What has changed since you've started to now, just in your field and with technology? Are you seeing some pretty amazing things?
Yeah, I will say there's a lot of new developments that have been coming out, especially in terms of speech and noise. So that's where people generally have the most difficulty, is anytime there's background noise and they're trying to have a conversation, it's really, really difficult to kind of weed out the noise in the background and focus on that speech that you're trying to hear. A lot of manufacturers have come out with some technology where it kind of reads that background noise and tries to completely kind of remove it and really boost that speech signal. And there are a few manufacturers that do a really good job of that, and patients have a lot of good outcomes with those. So that's a big change that's been recent in the past few years that I've seen, where we're like, wow, it's really a clear signal that's coming through for people, whereas previously it was kind of hard to distinguish between like a noise in the background, that kind of sound wave, versus like a speech sound wave. So it kind of all got amplified, which is not what we were going for.
Yeah.
But yeah, in recent years, it's been a really good kind of advancement in that area.
What were some things that made you say, yeah, you know what, Northwest Pennsylvania, Titusville Area Hospital, yes, that would be a great opportunity?
Yeah, I think I just was really interested in kind of the hospital setting. I really enjoy, I wouldn't say faster pace, but it sounded like there was a need for someone to come in and kind of be working here with both the ENTs, especially Panaru. She has a busy schedule. I was really excited to kind of see, a diverse patient schedule. So, and I knew from being here, even just on the holidays, that there was a need here. We talked about it before. And I kind of was just interested in seeing kind of how I could help people out.
Yeah,
So,
it's great when you can think, boy, I could make a difference.
yeah.
Now, and Kelly, maybe you can chime in. When it comes to those services, can they call the office directly, or do they work with their primary care physician? Do they work with a specialist? And then how do they find you in the whole chain of things?
So it can happen several different ways, really. You can start with your PCP, maybe let them know that you've been having some issues with hearing, and they can send you a referral to the ENT or directly to Devon. Also, like she had mentioned, the school hearing tests that are being done, a lot of those referrals will go directly. Would they go directly to you or directly to the PCP? Not sure.
It could be either. I know previously sometimes they came directly to me, or they could go through the PCP.
Right.
Like Kelly said, there's usually a few different ways. They could directly schedule, I think, through there was a phone number or general scheduling.
So her direct line to schedule, if you wanted just to call and do that, is 827-9770. So we are still in the process of setting up all the equipment. There's a lot of equipment that is required for audiology. So she'll have brand new equipment, everything new and updated. Yeah,
That's exciting.
I'm super excited.
yeah. So that was a big push to make space for that.
Is that at the hospital?
Yes.
Okay.
So it's actually for anyone that is familiar with the first floor, where physician services, there's a ton of specialty services there. So it's kind of getting crowded. So what we are using is the first hallway. So when you get off the elevator, that used to be where Dr. Ferrer was, the OBGYN Associates of Erie. So we are redoing that entire hallway and making that hallway dedicated to ENT and audiology. So like I said, there'll be some new equipment that's actually being put in right now. So she'll be ready to start taking new patients as soon as that equipment is ready. But you can go ahead and call the office, and they would have an update of when you can go ahead and get those appointments scheduled.
That's great. Well, that's really exciting.
Yeah, I can't wait.
Yeah.
Let's do this real quick. You're watching The Morning Drill on Stream TV and on the Armstrong Neighborhood Channel. Our friends from Titusville Area Hospital with us here this morning. Kelly, we got a lot of other things going on, too, that we want to mention real quick.
We do. So the Titusville Lions Club is hosting a rural healthcare services seminar. It will be on September 24th. So anyone is invited to come to that. It's for the public. It starts at 2 o'clock. It will be at the Titusville Library. It's right on Main Street. And there'll be some providers from Titusville Area Hospital and also the provider that takes care of the Titusville Health Center and the Titusville Health Center, Laura Divins, will be there. I will be there. Megan Miller, she's the practice manager and oversees all of those rural health clinics, will be there, and also Charlie Gates. And really just talking about different things that we are doing and the community is doing to reach those rural areas, and what changes are in healthcare, and really just a good way to make contact with the community and again, see what those community needs are. Like we talk about so much, how do you decide what the need is? And things like this is a good indication of that.
Yeah. And we spent a lot of time talking about, how you kind of discover those needs, whether it's patients filling out surveys or doctors saying, boy, it'd be helpful to have maybe this. And I think the big takeaway is your comments, your feedback, they don't go unnoticed. You guys go through them, you look at them, you obviously you act upon them a lot of the time, not
Right.
all the time, but it's great to know that people are listening.
Oh, definitely. So yes, so that will be happening. We were excited to be asked to come to that and speak at that. Like I said, the Lions Club will be hosting that, so there'll be a panel set up. They'll be asking a lot of questions of the panel, and also afterwards there'll be time for the community to ask any of the members to, answer any questions that they may have about, the future of our rural healthcare here.
Great.
Yeah.
Awesome.
So I'd also like to touch base. We brought neurology here recently. Amy Kaufman, a neurologist, she is at Meadville Medical Center, but she has a lot of patients that she sees that are Titusville residents and closer to this area. So she started having office hours here in Titusville to kind of alleviate that travel for the patients that were doing a lot of travel to see her. And she's also seeing new patients here as well. So if there's something that, you would like to see a neurologist but didn't want to travel, I did just want to mention that we do have her here a couple days a month, having office hours. If you would like to schedule with her, you can call it's a Meadville number. It's 333-3929, and just let them know that you would like to be seen in the Titusville office.
That's awesome.
Yeah, so something new, adding a lot of services. Like I told you, we have another ENT that will be joining us. We also have dermatology coming very soon. She will be starting beginning of January, probably, we hope. Yeah, so that was also a big need. That everyone is going to be very excited to have dermatology brought closer to home instead
Awesome.
of having to travel outside of the area.
So look for that coming soon.
Coming soon.
Crawford Gives was last month.
Crawford Gives, thank you everyone that donated. Those monies went towards our new renovation of our outpatient therapies, which includes physical therapy, speech therapy, and occupational therapy. We have a really, really great new things that are going into the new facility. The new building that we are renovating will be the old Rite Aid building, and moving all of those entities into the Rite Aid building. Adding a pediatric sensory room, which is definitely, we talk about needs, I know so much, but it is definitely a need in the area, and it will be the first one in our service area. I think the closest one is possibly Erie. So right here directly in our service area, it will be the only one. So we're excited to be able to bring that. And in the PT building that we will be leaving was where our new regional dental clinic will be.
And
Opening
that's very
in
exciting.
July. Yeah,
That's coming fast.
it is. Yeah. So that will be opening in July and will really offer a lot more access to care for the folks here in the area.
All right. And you'll be back with us next week.
Yes.
So
I'll be back next week, and I'll be bringing some Penny representatives. So anyone that, is maybe unsure about healthcare right now, we have 2 representatives coming on with me next week. They're going to be offering a ton of information, and it's for anyone that's currently uninsured. Open enrollment is coming up in October, so that's coming very soon. And they offer a lot of free services, doesn't cost anything, to get an appointment with these girls and talk about your options for healthcare. If you're self-employed, if you don't meet the requirements for access, they can get you hooked up with some Penny insurance to get you covered for the new year.
and real quick, if you go to the Facebook page, it seems like every day there's posts of updates and lots going on. Welcoming McKenna Cole, somebody
Yes.
that is known in our area, but she's back and
McKenna Cole, we added her to our Oak Street Pediatric office. She joins Dr. Maria Munoz and Dr. Diaz. So she has been working alongside them for quite a while and now is starting to see her own patients. So if you're looking for a new provider for your kiddos, she's now taking on new patients. She is phenomenal, really great, fits in so well in that office. Katie Vincent is there as well. And they just have so many kiddos there that they take very good care of.
that's right. And then, of course, just a reminder, looking for a local healthcare provider. Well,
Yes, so that's Lara Divins, and she takes care of, like I said before, the City Ute and Tionesta clinics, and she will be at the Lions Club talk that's on 9/24, right?
Yep.
Yeah.
perfect.
So she'll be covering some information about different things that they do in that office. So since it is a rural health clinic, we try to offer a lot of services there. So they have vaccines for kids there, which is free vaccines for anyone that meets those guidelines. They have blood draws available on most days that they are open. And so you don't even have to be a patient there to get your blood drawn there. And it's really just to help the community and so they don't have to travel outside of the area.
Awesome. And then October is Breast Cancer Awareness Month. We can talk more about that later. Devon, I want to give you final words here before we wrap up this morning. What should somebody do if they're like thinking, okay, yeah, I think I'm struggling a little bit? What's that push to call your office?
Yeah, I feel like it's always good to have a baseline either way. If you're not noticing any difficulty and you've never had your hearing tested, if you're noticing like little things that are happening, anytime is good to come in and get a baseline. It's always better to have the information and kind of know how things are going, and then do annual testing from there. Or if you're starting to have more difficulty, then you know, oh, this is where I started and this is where I am. So you can even see the progress of that as well. So we're always open to people coming and kind of checking how things are going.
Well, welcome.
Thank you.
Congratulations. Good luck.
Thanks so much.
Awfully exciting. You want to come back and give us an update on everything.
Yes, I would love to.
All right, Kelly, good to see you too. Thank you.
Good to see you. Thanks, Luke.